Preface. In almost a century of surgery, few advances can be compared to the changes brought by the introduction of minimally invasive surgery that represent a true revolution in surgical practice for the greatest benefits offered to the patients. Since the early 1990s, laparoscopic surgery has evolved significantly, covering all ranges of procedures from simple appendectomy to liver and kidney transplantation. The obvious success was mainly due to the better outcome and acceptance from patients for the several benefits. Today, some procedures have been completely replaced by laparoscopic approach, also changing the way we teach and practice. In fact, the revolution behind laparoscopic surgery also brings new concepts in training and gaining proficiency. Technological advancements were introduced in training programs like surgical simulators, virtual reality, surgical pre-planning, making space for new and more objective training program with full involvement of the surgical trainees in hands-on practice and skills acquisitions. All tools that are mandatory and necessary are accessible in current surgical training centers to enforce the skills needed for both basic and advanced procedural training. But of course, all these activities must complement also an active clinical practice with proctoring and fellowship. In a new panorama in surgical education, more online training programs are taking place either on online dedicated learning platforms or on social media, with all the pros and cons. The decision to publish this manual is mainly to provide to all surgical trainees and all surgeons that want to start endo-laparoscopic surgery a compendium of core information and knowledge, and also pearls and tips to learn and to improve their surgical skills. This aim is fulfilled with the decision by the Endoscopic and Laparoscopic Surgeons of Asia, ELSA, to make it available as open access for all. This manual has been an effort of ELSA experts and is organized in sections in which surgical technical aspects of each procedure is presented and analyzed from the procedural point of view. Our aim is to provide information in detail from patient's preparation and OR setup to the surgical steps and managements of complications. We would like to extend our sincere appreciation to all the section editors, authors, our illustrators for their contributions who have been outstanding throughout the editorial process, and to our families for their continuous support. Davide Lamanto, Singapore, Singapore. William Su Liang Chen, Taichung City, Taiwan. Mary Lou B. Fuentes, Pasig, Philippines.